Hi, I'm Steve Adubato. Thank you so much for joining us. If you know our series, you know that we have had the First Lady of the great state of New Jersey, Tammy Murphy, on many times. We're honored to have her again. First Lady Tammy Murphy, thank you for joining us.
Thank you so much for having me. Always great to see you, Steve.
Absolutely. Listen, so much ground to cover. Can we start with Nurture NJ? Where is it? What is it? Remind people. We talked at Drum Thwacket last time about this. Remind people what is it and why it matters right now.
Okay. First of all, let me give you a little bit of framing. The United States is 55th in the world for maternal mortality rates. New Jersey is 47th in the country. When first day of Phil's administration, I felt like this is something I wanted to tackle, being a mom of four, and really I didn't know what I was getting myself into, I have to admit. But what it really is it's centuries of systemic racism, it's implicit bias. A Black mother in New Jersey is seven times more
likely to
die from maternity-related complications than a white woman. And a Black child is over 3 times more likely than a white child in New Jersey to die before his or her first birthday. So that just gives you the context in which we're operating. For the last 3 years, my awesome team and I have spread out across the state, met with stakeholders. We've coordinated family festivals, bringing together thousands and thousands, over 6,000 different families with resources at the state, county, and local level in different hotspots around our state. We have held live interviews during times of COVID so that we can bring resources to people in need, like lactation consultants and doulas and things like that, to explain what resources are out there. We started this out with 2 agencies working together with us, obviously Department of Health and also Family and Children's. We now have over 18 different agencies who work with us and work with us daily, but we have quarterly meetings. We have an annual maternal and Black infant health summit. The legislature has been working with us very closely. I think in the last several years, Phil signed over 35 pieces of legislation just dealing with this. We announced our strategic plan 2 weeks ago, and it's going to be transformational. It is great timing.
First Lady Tammy Murphy, let me ask you this. If people want to find out more, as you say, we'll put up the website in post-production. What is it? It's
nurturenj.nj.gov.
Say it again, please.
nurturenj.nj.gov.
Got it. This is a related topic, and you and I have talked about this before. I've told you several times that we're involved in an initiative, a public awareness initiative around childcare, access to quality, affordable childcare, reimagined childcare. That website will be up as we talk right now. A priority for you as well. How has COVID, a year into this, we're taping on the 16th of February, it'll be seen after, how has COVID exacerbated the child care crisis in this state and nation?
Listen, anywhere where there was an inequity or a fault line prior to COVID, it has been completely surfaced over these challenging times. So for example, if someone was already having trouble accessing child care, if someone was already having trouble meeting their financial requirements, whatever they may be, whether it's or you pick it, COVID has made this problem even worse. People have lost their jobs. People are having to socially distance. Childcare can only take so many people at a time. In many instances, they're being shut down. In many instances, there wasn't enough childcare to begin with. So the problems have been exacerbated, just like the inequities. It's the inequities across our state and our country that are being brought to the surface and President Biden is focusing on this. So it's something that we all understand. It's the inequities.
A lot of this is related. So the question of ACEs, adverse childhood experiences, a top priority for you. I remember we actually sat down with you at a conference that was held in Princeton around this topic almost 2 years ago. As it relates to adverse childhood experiences, there's an action plan that's been put together. Explain to folks, Tammy, if I can call you Tammy.
Obviously can.
What adverse childhood experiences are and what action plan is being put together to address those very important issues?
Sure. So first of all, adverse childhood experiences are myriad. They can be physical, they can be emotional, they can be social, they could be abuse. You could suffer from child abuse. You could have substance abuse. You could be go without food. I mean, there are so many different pieces.
You could be abandoned as a child.
Yes, it literally, Steve. There's about, I think, 11 adverse childhood experiences. So if you accept the fact that these bad things are happening to a child, what ends up happening is that child grows up and the cycle repeats itself. So by tackling these adverse childhood experiences, which, by the way, the cycle will repeat itself with mothers. So for example, if you grow up and you've had these challenges as a child, you're going to have babies who are preterm. You're going to have babies who have lower birth weight. There's so many pieces of this puzzle that if we don't stop it in its tracks here and now, it's just going to carry on as it has done historically. So the ACEs plan is a 2-year plan. It's part of Nurture New Jersey plan. So this is all fundamentally related because, once we stop all these inequities and we start looking at the person as a whole and dealing with people on a better level, then we're going to have healthy babies, healthy moms, healthy families, and we can move forward in that direction.
Can you give us 30 seconds? I want to ask you about March 4th. We're taping on the 16th of February, but there's a lot of significance around March 4th. I'm going to ask you that. But can you do the Pandemic Relief Fund for 30 seconds? Remind folks what it is and why it's so important now more than ever.
Yes. njprf.org is the website. The Pandemic Relief Fund was started. I started it last March, almost at the outset of the COVID pandemic. It was brought together essentially to raise money and disperse to those most impacted by the COVID pandemic. We have to date raised nearly $65 million. We have about 63,000 donors from every county in New Jersey, every state in the United States, and foreign countries. And we are really working hard in the areas of digital divide, education, healthcare, food security, mental health. There's a lot of different pieces here.
By the way, our friends at New Jersey Manufacturers told us about an initiative. They care deeply about Trenton. Trenton is one of those cities where this digital divide is terrible, right? What's going on there? Because I know you're providing the Pandemic Relief Fund is really making a difference in terms of Wi-Fi. Real quick, if you could, Tammy.
Yeah. So we decided, I think you all know, in June of last year, 230,000 students across the state of New Jersey had no access to either equipment or to the dial-up or access to the Wi-Fi. That gap has been brought down both by what the government has been doing, the administration, and then the Pandemic Relief Fund also jumped in, and we went to about 9 different school districts and worked directly with the districts. Trenton was the first one, and we helped close the digital divide. One thing about that, though, Steve, is that people think about the digital divide just being for children who can't gain access to school, which is horrible, and we're leaving a whole generation behind on that level. But on top of it, it's enabling families that don't have these resources. It's giving the grandmother the access to telemedicine. It's giving the dad the access to job listings so he can search online to find a new job. I mean, it's providing a lifeline for families.
I'm Steve Adubato. That is the First Lady. Thank you, Tammy Murphy. We appreciate it. And give our best to the governor. By the way, we're taping on the 16th of February. March 4th, an important date in New Jersey. It was not only the first case of COVID in New Jersey, it was the day that Governor Murphy was operated on, and he was out there working immediately. We're going to talk leadership with Tammy Murphy on our sister program, Lessons in Leadership with Mary Gamba. Thank you, Tammy. All the best.
Okay. Thanks, Steve.
We'll be right back after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Turrell Fund, supporting Reimagine Childcare, NJM Insurance Group, the Healthcare Foundation of New Jersey, Georgian Court University, PNC, Grow Up Great, Horizon Blue Cross Blue Shield of New Jersey, Johnson & Johnson, MD Advantage Insurance Company, and by St. Joseph's Health. Promotional support provided by NJ.com and by ROINJ. Being a kid is all about playing, laughing, and having fun.
doing what they do best, from rolling in leaves to building a snowman. But when illness or injury slows your little one down, you want the best pediatric care possible. Turn to the experts at the St. Joseph's Children's Hospital to get your superhero feeling super again. St. Joseph's Health, helping kids be kids.